Hello?
Yeah, ma'am.
Yeah, I was just not able to like unmute my thing. Now I am able to. Thank you.
Okay, okay, fine.
Hello? Hello, can everybody hear me? Okay. So I'm extremely sorry for the delay. There was some internet issue at my place, and because of which I could not connect. So I'm going to start our lesson. Okay. So today we are going to, as I mentioned yesterday, we will be starting uh, basically talking about anxiety disorders. Okay. So, anxiety disorders. I'm going to start screen sharing. Okay. So, can you see the screen? Okay. I think the host is not allowing you people to unmute your I think speaker. Okay. Anyways, so anxiety disorders. So, anxiety or neurotic disorders are considered as an exaggerated response to stress. Okay. In contrast to, so there are, so when we talk about psychological disorders or, or mental illness, under psychological disorder, there are, if you can like broadly, there are, we call one set of disorders as psychotic disorders and another set neurotic or anxiety disorders. And then we have our personality disorders, disorders of childhood. So, psychotic disorders and neurotic or anxiety disorders, there are, there are two main differences, if you can say. Um Okay, so there are two main differences. When we talk about anxiety disorders, the core feature is there is an exaggerated response to stress, and see the main differences between anxiety and psychotic disorders is, you know, anxiety disorders, the person is still in touch with reality, and in psychotic disorders, the person loses touch with reality. Okay. And in psychotic disorders, the person experiences hallucinations, delusions, and loses his insight. And under neurotic disorders, it's very, very rare. Maybe under severe conditions, the person might experience delusions or hallucination, but mostly, in most of the cases, they don't experience hallucinations or delusions, and they usually retain some, insight. What do you mean by insight? Insight means like, yeah, that there is some problem, there is some issue going on with him or her, and they have this sense that they need treatment, they need some help for it. But in psychotic disorders, they believe that there is nothing wrong with them and they don't require any help. So that is what we call as insight. And somehow they know that they themselves are contributing, or they need to change, do certain bring about certain changes in their behavior and which will help them. But in psychotic disorders, they don't really believe that there is anything required. Okay. So neurotic disorders can be considered as an exaggerated response to stress. And neurosis covers a range of common conditions, including generalized anxiety disorder, panic disorder, phobias, obsessive compulsive disorder, and reaction to stress. Okay, so generalized anxiety disorder is the person experiences continuous unfocused anxiety. That is, the anxiety, the stress, the experience is not actually related or identified with any particular situation or object. There is a free floating sort of form of anxiety is what they experience. Okay, so continuously there is they experience uh, free floating anxiety, and worry is a common core feature of generalized anxiety disorder. Panic disorder, they experience episodes of panic disorder is where the patient or a person will experience episodes of acute anxiety or severe anxiety, and where the episode is so acute that the symptoms of anxiety are so severe that the person sometimes feels as if he's having a heart attack. Okay, so and the specific phobias are anxiety related to specific objects or situations. Objects could be like, for example, spiders, fear of needles, or snakes, or situations could be like fear of heights, fear of taking a lift, fear of closed spaces. Okay, so or social situations. Uh, Obsessive compulsive disorders is anxiety related to obsessive thoughts, and uh, after having experiencing those obsessive thoughts, the person will have take part in compulsive ritual behaviors. Reactions to stresses, that includes adjustment reactions, and especially what we call as PTSD, that is post traumatic stress disorder. If a person has been in a traumatic incident, uh, it has experienced a very traumatic, had a very traumatic experience, then the person would, uh, after having gone through that traumatic experience, the person would, show some adjustment reactions, would show some stress reactions after the traumatic incident. Okay, so and we call such reactions as post-traumatic stress disorder. Okay, and anxiety is a core feature of all these different disorders. Okay, that is why we call them as anxiety or stress disorders, neurotic disorders. So anxiety is the core symptom of neurotic or anxiety disorders or fear related disorders. What is anxiety? Anxiety is an unpleasant state that involves a complex combination of emotions that includes fear, apprehension, and worry. An anxious person worries a lot, particularly about unknown dangers. He is not like, fear of, uh, something happening to him, not getting help on time. Uh, okay, so fear of experiencing unknown danger to self and to his loved ones, family members, continuously worrying about something happening. Okay, it is often accompanied. So when the person experiences anxiety or fear, it is often accompanied by physical sensations such as heart palpitations, nausea, chest pain, shortness of breath, or tension headache. So all of you have to realize anxiety. So when we talk about you know psychological disorders or mental health, people have this misconception that the person is will experience only mental symptoms, that there will be a sensation of like the person might, depending upon whichever psychological disorder he will experience, symptoms would be exclusively mental in nature. For example, like fear, apprehension, worried, sadness, anger. It's not like that. So when it comes to anxiety disorders, person, you cannot call a person as having anxiety disorder unless and until he shows both mental and physical symptoms. Okay, so anxiety comes not only with mental symptoms of feeling fear, apprehension, worry, it is also accompanied by physical symptoms. So, anxiety has to be accompanied by physical symptoms such as heartbeat, heart palpitations, increase in heartbeat, and there is a whole list of symptoms experienced differently by different people. Some people will, if they are feeling anxious, they'll experience stomach upset. Some people will, the heartbeat will increase. There is like a problem with the shortness of breath, so they will experience problem with uh, you know uh, uh, you know hyper they would hyperventilate. Some people will have tension headache. Some people with the will have excessive sweating, flushing, shivering, hands and legs turning cold. So there is, physical symptoms are also uh, accompanied along with mental symptoms. So anxiety is often described as having cognitive, somatic, emotional, and behavioral components. So anxiety is experienced is when a person experiences anxiety, he will actually have anxiety is accompanied by cognitive, that is the person's thinking gets affected, somatic, physical symptoms, emotional, his emotions, and which again, like the person when he is experiencing heightened level of anxiety, his behavior also gets affected. However, anxiety is not always pathological or maladaptive. You have to understand something very critical. Anxiety is not bad. Anxiety is not bad for us. All of us, see, it actually serves a protective mechanism. For example, if you are in a dangerous situation, and if you will not feel anxious, or if you not feel anxiety, or basically if you don't fear that, don't experience fear, then you will not do anything to save yourself. Okay. So similarly, in normal everyday situations, if students will not feel anxiety, they will not prepare, they will not study for their exams. If a professional will not experience anxiety, he will not perform well at his job. So previously, now these are our current situations. So previously, anxiety is inbuilt in all of us. It's actually, uh, helps to protect a species, if I can go as far as say, and say that, okay, because it serves a protective function. So if there is a dangerous animal in front of you, if somebody is holding a gun to you, okay, if you are stuck in a dangerous situation, if you will not experience anxiety, you will not do anything to save yourself. So you have to, anxiety is, it serves as a protective mechanism. Okay. So now there are different types of anxiety. We experience different types of anxiety: existential anxiety, test anxiety, and stranger anxiety. This is something extra. I'm just telling you. It is not included in your lesson. So existential anxiety is sometimes we experience anxiety that we feel that what am I doing? Such like philosophical. Sometimes you experience such. Uh, a person might have these thoughts like what is the meaning of purpose of my life, what am I doing, what is the meaning of existence, such so when a person has such questions, he will experience existential anxiety. Test anxiety is your for example, students or an adult, if he has to like uh, there is a situation where he has to perform at his best, and he has to, there is a testing situation, and then a person experiences test anxiety. Stranger anxiety is especially related to social situations. The person will experience anxiety in social situations, interacting with other people, will feel very anxious, how he will be judged. So now anxiety disorders. See, in your book, these are the disorders your lesson is covering. Okay, and these are the categories. Now they have changed, as I mentioned yesterday, from anxiety. They have changed. They have taken away obsessive compulsive disorder. In DSM-5, they have taken obsessive compulsive disorder and made it into a separate category. Okay, so but as students, you need to know, like, these disorders. Okay, so we will be talking in this lesson, we will be covering these disorders: anxiety disorder, panic disorder, phobias, obsessive compulsive disorder, and post traumatic stress disorder. So now let's talk about generalized anxiety disorder. Okay, so what is generalized anxiety disorder? It is an excessive, as I mentioned just now when we were talking, a generalized anxiety disorder is the person will experience anxiety, okay, under most situations, circumstances. It's almost as a, he or she experiences anxiety the whole day. Okay, and there is this free floating sense of anxiety the person experiences, just free floating continuously. The person is anxious, and worry is a core feature of generalized anxiety disorder. The person worries about everything. If he has to take an auto, the person, or she has to take an auto, the person will start worrying 1 hour before. Any, how will I take an auto? Will I get an auto? Will I, if the person has to arrive at particular social situations, or basically attend a wedding or a function, he or she will start to worry 2 days in advance. How will I prepare for it? Will I get, how will I be able to be ready on time? Or the person will experience worry, for example, if their family members are out, so they're continuously worrying about their safety. Or if they watch any TV program and they talk about some crime or something is going on, then they'll start to worry about it. Like, what if it happens to him? What if their family members? So continuous, everything is can trigger their worry. So they worry under most circumstances. Okay, and the symptoms experienced by them is restlessness, fatigue, difficulty concentrating, muscle tension, and sleep problems. And symptoms much. So yesterday, when we were talking about classification, and one of you had asked me, like, what is the criteria for classifying the mental illnesses, disorders? So I had mentioned that, the classification is done based on signs and symptoms. Okay, and along with that, along with signs and symptoms, there are certain other criteria also, and that is the duration. Okay, so you cannot decide or diagnose a person as having anxiety disorders just because the person has started to feel anxious or started to worry for 1 week or 2 weeks, like that. Symptoms must at least be present for 6 months, then you can call a person as experiencing anxiety disorders. So this disorder is most common in Western society, not now though, like it is seen in our Eastern culture also. Usually appears in childhood or adolescence, and around one quarter of those with generalized anxiety are currently under treatment. So people with generalized anxiety disorder experience chronic and pervasive anxiety. As I mentioned, continuous, chronic. Okay, it doesn't really, that anxious feeling, that uneasiness, that discomfort, that anxiety doesn't really leave them. Okay, they feel tense and worried most of the time, which causes them distress and interferes with their functioning. It interferes with their everyday function, interferes with their occupational functioning, interferes with their work, interferes with their relationships. Okay, and the anxiety, worry, or physical symptoms cause significant distress or impairment in normal functioning. And one very, very critical criteria also, and this I will be repeating again and again when we'll be talking about each and every disorder. So this is actually one of the criteria, that the symptoms shown, the symptoms experienced by the person should not be better explained or should not be due to a medical condition. Okay, so if a person is experiencing these symptoms and you can explain those symptoms because of some medical condition, then you cannot give a diagnosis of generalized anxiety disorder. So medical conditions have to be first ruled out. Okay, and these symptoms should also not due to, like, the person is taking some sort of medicine, and because of that medicine the person is experiencing these symptoms, then again you cannot call the person as having psychological disorder, or should not be because of any drug effect. Okay, so all these symptoms should not be due to effects of a medicine, drug, or any medical condition. So generalized anxiety disorder, what is the prevalence? Prevalence is their percentage in the population, how much it is seen in the population. So almost approximately 4% of the population experiences generalized anxiety, and out of which two-thirds or those with GAD are female in development countries, and it is also seen more. It's more prevalent in elderly population, that is about 7%. So how do we explain generalized anxiety disorder? Just a second now. Yeah. So now we're talking about the uh, causes. Basically, how does this develop? How does a person, develops generalized anxiety disorder? So when we were talking about different models of psychological disorders, we talked about different viewpoints, and every viewpoint has their own explanation about how this particular psychological disorder uh, develops, or how this particular psychological disorder is triggered in a person. Okay, so according to socio-cultural perspective, that is socio-cultural viewpoint, generalized anxiety disorder is most likely to develop in people faced with social conditions that are truly dangerous. Okay, so for example, if a person has experienced, and there is a lot of research which supports this theory. So they have done, they have found that after a person, after a particular set of population has experienced some natural calamity, some traumatic incident, and after that incident has happened, the people have started to show symptoms of generalized anxiety disorder. For example, like, Hurricane Katrina, there was a huge hurricane in 2005, and earthquake in Haiti in 2010. After some people had experienced these calamities, the population started to show symptoms of generalized anxiety. And if I can even say, like, the most recent, that is our COVID pandemic. And I've also in my clinical practice, I have seen this phenomena. So after COVID, lot of my patients, a lot of people in the population, after going through this COVID pandemic, they started to experience generalized anxiety. There was an increase in anxiety disorders in the population after the COVID scare. Okay. So, and one of the most powerful forms of society stress. So that is one explanation, that people will anxiety disorders, will be an increase, or there will be people will start to experience generalized anxiety disorder after they have experienced something traumatic, some traumatic event, some dangerous condition, social condition. Okay. And the second explanation is poverty. So one of the most powerful form of society stress experience is due to poverty. So being part of, belonging to rundown communities where crime rates are high, and where few education job opportunities are present, and there is a greater risk for health problems. So it is predicted that people who belong to such status will experience generalized anxiety. Okay. So, and according to psychodynamic perspective, Freud believed that all children experience anxiety. Okay, and they experience realistic anxiety when they face true actual danger. Neurotic anxiety disorder, a neurotic anxiety when they are prevented from expressing their id impulses, and moral anxiety when they are punished for expressing id impulses. I mentioned in when we were talking about models, and when we were talking about ego and superego. So I told you, or explained to you, that it is, that part of a personality which is dictated by pleasure principle. That if it wants something, it wants it now, very impulsive nature. Okay, so when a person is wants something, and the person is stopped from getting or expressing his or her impulses, okay, or it's the person is punished for expressing his impulses, then the person will experience moral anxiety. Some children experience particularly high levels of anxiety, or their or have exhibit defense mechanisms, or their defense mechanisms are particularly indicate inadequate, then they go on to develop generalized anxiety disorder. And according to humanistic perspective, theorists propose that generalized anxiety disorder, like any psychological disorder, arises when people look at themselves honestly and acceptingly. Okay, this is best illustrated by Carl Rogers' explanation. According to him, the lack of unconditional positive regard in childhood leads to conditions of worth. That is, when a child, during his childhood, he's not been given unconditional positive regard, unconditional positive support by his primary caregivers, then that will make him question his sense of self, his self-worth, and then he will always be putting himself, judging himself to very harsh standards. Okay, or if he is during his childhood, he's been continuously unless and until you meet a particular standard, the you will not be loved, or you will not be accepted. If such type of childhood, if the child experiences, then that will lead him to later on develop anxiety. Okay, so these threatening self judgments break through and cause anxiety, and setting the stage for generalized anxiety to develop later on. And according to cognitive perspective, they believe that generalized anxiety is caused by maladaptive assumptions. So Albert Ellis identified, he's he's the one who proposed that psychological disorders are triggered because of irrational assumptions. What are those irrational assumptions? Is that we always have some set of rules for ourselves. Okay, and for example, like everybody should like, I should always come first. Okay, so such rigid rules, like everybody, whosoever I meet, they should like. Okay, so these are very irrational. So assumptions, like, how is it possible that each and every person we meet, they will like us? And how is it possible to always be first, always be winning? It's not rational. Okay, so psychological disorders are triggered when a person has such irrational assumptions. Okay, so all of us as human beings, we like to be loved or approved by almost everyone, but it is not possible. Okay, then as we grow, we also understand that yes, we cannot be everybody's cup of tea. Okay, so we are okay with it as we grow. We don't like it if people don't like us, but still we are accepting of it. It's okay. Some people might not like us, but there are some individuals who are like, have this rigid assumption or rigid rule that everybody should like me. And you know if they suddenly come across somebody who doesn't like them, then it makes them, it is very awful and catastrophic when things don't go as they always assume they should, or people don't like them, or they are not always first in the class. So till the time the person is always coming first, always winning, everything goes fine. And the moment the person is not able to win or not able to come first, then that triggers anxiety in that person. Okay, these assumptions and rules uh, are applied to our everyday life and to more and more events. Okay, such irrational assumptions, and which in turn will lead to person to develop generalized anxiety. And what is the biological perspective? That is, how does the medical model explain anxiety disorder? So, biological theories believe that generalized anxiety is caused by biological factors chiefly. Okay, and one of the most important findings is supported by family studies, and they have found that there is a genetic link, there is inheritability. If a family member or a parent experiences anxiety disorder, so generalized anxiety disorder, then chances are that at least almost 15% chances are high compared to the the other population. So if a family member, especially the parent, if a parent has generalized anxiety disorder, the your chances increases by 15% that you will also develop generalized anxiety disorder. So the closer the relative you are, like, okay, so for example, the grandparent, the chances decreases a little bit more. Okay, and parent chances are more. So the closer the relative who has generalized anxiety disorder, the greater likelihood that you would also develop generalized anxiety disorder. And second, as I told you, biological model, it also says that, if there is some imbalance in the brain chemistry, that can also trigger psychological disorder. So according to this theory, if there is an inactivity in a neurotransmitter called GABA, okay, that can also, uh, there is an imbalance in GABA neurotransmitter, uh, then that can trigger generalized anxiety. Okay, so with this, you have finished generalized anxiety disorder. Now we are going to start panic disorder. So what is panic disorder? Panic, people with panic disorder experience discrete episodes of intense terror. Okay, these episodes are, they last anywhere between 5 to 10 minutes. Okay, they don't go on. It's an episodic in nature. Okay, and these episodes is what we call as panic attacks. Okay, these when they are experiencing these episodes or panic attacks, they'll experience intense level of terror in which they will feel overwhelmed by anxiety, and will feel as if, like, some people, many of them feel as if they might be having a heart attack, because they are also experiencing physical symptoms when they are experiencing this panic attack. Okay, and they will feel a strong urge to escape or to get help on that help. In contrast to generalized anxiety disorder, which involves chronic but mild anxiety, people with panic disorder experience extreme, acute burst of extreme anxiety. Episodes of intense panic attacks include, at least, so before going ahead and diagnosing a person as having panic disorder, there are certain criteria which has to be fulfilled. Okay, so they have to, you cannot just say, just because the heartbeat is increasing, you cannot just say that a person is, or a person is feeling extreme anxiety, you cannot say the person is having panic attack. Okay, they have to have it has to include at least four of the following symptoms. Okay, physical symptoms, that is pounding heart, sweating, shaking, shortness of breath, feeling of choking, chest pain, nausea, dizziness, fear of losing control, fear of dying, numbness or tingling, chills or hot flashes. Okay, and persistent concern about having additional attacks. So once they experience a panic attack, and that experience is so intense, so terrifying for them, that they will just start to worry regarding whether they will have any additional attacks, and they'll start to worry about consequences of, what if I go out and I'll suddenly have such an attack, and what if I will not get help on time, what if I will not be able to escape, what if something happens to me. Okay, so after that first initial incident of panic attack, they will now start to continuously worry about any future events, worry about having any additional attacks. Okay, which can lead to avoidance behavior. So these people will stop avoiding such situations which they feel can trigger these attacks. Okay, and their behavior changes because of fear of having such future attacks. So panic attacks should not, again, important criteria. Panic attacks should not be better explained by any other medical conditions, should not be because of influence of any medicine the person is currently taking, should not be because of any drugs. So panic disorder involves an attack of labored breathing. That is, they will start to hyperventilate. They will experience shortness of breath. Okay, has they experience difficulty in breathing, nausea, chest pain, dizziness, and intense apprehension. That is intense feeling of terror, depersonalization, feeling that, as if, like, they'll experience as if they are outside their body, realization, feeling that the world is not real. They feel as if, the world is not real. And what is the prevalence? Lifetime prevalence for panic disorder is 2% for men and 5% for women. So causes of panic attack. So according to biological factor model, Panic attack is due to imbalance of neurotransmitter norepinephrine. Okay, so it has been found that there are irregular levels of norepinephrine, neurotransmitter norepinephrine, in people who experience panic attacks. Okay, research also suggests that panic reactions are related to changes uh, in norepinephrine in the local ceruleus area of the brain. Research conducted in recent years has examined brain circuits and the amygdala as the more complex root of the problem. So they have found that there is some problem with the certain structures of the brain, such as brain circuits and amygdala, which can trigger panic attacks. Okay, and they've also said it is possible that some people inherit a predisposition to abnormalities in this area. So how does this genetic link explain? So some people, they found that people are sometimes predisposed to uh, experiencing disorder because either their parent or grandparents have also had panic attacks. And research has shown that panic attacks are linked to some issues, some problems in their brain circuits and amygdala region of the brain. And they find that this problem in brain circuits and amygdala can be inherited by the offsprings. And if you inherit problems in these particular areas, obviously you are much more vulnerable to experiencing panic attacks. And how does cognitive perspective explain? Cognitive theories recognize that biological factors are only part of cause of panic attacks. In their view, full panic reactions are experienced only by people who misinterpret body events. Okay, so what they say is like, misinterpret body events mean, say, I have already explained that, anxiety doesn't come alone. There is just not, a person will not only experience emotional symptoms or cognitive symptoms, they also experience physical symptoms. But nobody has ever told us, we all know that if I'm running a marathon or if I'm climbing 10 stairs, 10 flight of stairs, uh, my heartbeat will increase, I'll be flushing, I'll be all red, I'll be sweating, I'll be having difficulty breathing. Okay, so we were always told if you are taking part in a rigorous physical activity, you will experience these symptoms. And if a person who's run a marathon and is having an increase in heartbeat, is huffing and puffing and coming to you and asking you to call an ambulance, you'll say, no, 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 just sit down, take deep breath, sit on this chair, you'll be fine. You will not call an ambulance. But nobody ever told us. We know that if a person is involved in such rigorous physical activity, he will exhibit such physical symptoms. And we will not misinterpret as thinking that he's having an heart attack. But nobody ever told us that, anxiety, just by sitting in my chair, if I start to worry about something, or, if this anxiety, panic attack can get triggered even by just sitting on a chair, and I can experience the same set of symptoms as if I'm running a marathon. Okay, so nobody told us like that. So for some people, especially people who experience panic attack, for them, like, they are now doing nothing. They're going about their normal work, and suddenly out of nowhere, they are having these severe physical symptoms, and they will and immediate reaction would be something happening with me. Am I dying? Am I experiencing a heart attack? So they don't know that it is an anxiety which got triggered and you're not really dying. So what happens is that people who experience panic reactions, they will misinterpret these body events, and once they experience panic attack, they are so scared of these physical symptoms, the intense terror which they have experienced, and then they, after that one particular episode, they will again you know start to fear, worry that whether we'll be having such symptoms, fear having further attacks, fear that they will not get help on time, fear that they will something will happen to them. Okay, so misinterpreting physical reactions can lead to for them so our cognitive so under cognitive perspective, the treatment is aimed at correcting such misinterpretations, making them understand that it's not that something is happening with your body, there's nothing wrong with their body. It's that you have this anxiety, comes with physical symptoms, and if these physical symptoms were triggered by anxiety. Okay. So, what is this misinterpreting bodily sensation which I just explained to you right now? So, panic prone people may be very sensitive to certain body sensations and they misinterpret them as signs of any medical catastrophe, which leads for making them panic. Okay. So, why some people are prone to such misinterpretation? It could be that, they experience more intense body sensations, and in their some time in past, they might have experienced more trauma filled events. Okay, whatever the precise cause, panic prone people generally have high degree of anxiety sensitivity. Okay, they focus on bodily sensation most of the time, are unable to access sensations assess sensations logically and interpret them as having something going wrong, or these sensations are harmful in nature. Now we'll talk about phobias. Okay, and so phobias, the most common of anxiety, phobias are considered to be the most common of anxiety disorders, and they are persistent and exaggerated. What are phobias? They are persistent and exaggerated fears of any particular objects or situations. Most people with phobias go out of their way to avoid the thing they fear, even if such avoidance is inconvenient and disruptive. Okay, so fear of needles. Okay, so they will try their best to avoid going for an injection. Okay, and whenever and but then sometimes see, uh, it's not really feasible for a person to continuously avoid, isn't it? So they will that leads to, but they will avoid that, some that situation. Or for example, fear of flying, aerophobia. So now in our current situations, in the lifestyles and everything, the professions and all that, flying is a part and parcel of everyday life. Is I mean, the easiest way of to travel nowadays. So if a professional, especially IT professionals, or where travel is there, so if that person is experiencing fear of flying, it's not really feasible, conducive. It disrupts their functioning, isn't it? So according to DSM-4 there are three subtypes of phobias: social phobias, agoraphobia, and specific phobia. Social phobia is fear of social situations. Agoraphobia is fear of open spaces, and specific phobia is phobia related to particular object or a situation. Okay, so now we are talking about specific phobia. Okay, what is specific phobia? Persistent, just a second now. So what is the diagnostic category for phobia? Persistent irrational fear of a specific object or a situation, and exposure to the fear object or situation usually triggers intense anxiety reaction. Okay, fear of spiders, arachnophobia. So these are the people, if they even see, or if they just know that this particular place has spiders, it will make them experience heightened level of anxiety. Person recognizes that the fear is excessive or unreasonable, but this still they cannot help it. The phobic object or situation is avoided or else endured with intense anxiety or distress. So, you cannot avoid injections, or, blood. Sometimes people have blood phobia also, fears involving blood, or injections, or fear of flying, aerophobia. So it's not possible to avoid it every time. So even if then they have to endure these situations, like when there is no escape, they have to fly, then they will endure that experience, that situation, with continuous intense anxiety or distress. Avoidance, anxious anticipation, or worry about feared object or situation interferes with their normal everyday functioning, and there is substantial distress about having the phobia. So what causes phobias? So we have different models explaining different viewpoints, explaining their giving their own explanations. Okay, so phobias develop through conditioning according to behavioral model. So conditioning is like, once, for example, fear of water, that is aquaphobia. So if a person has had a very traumatic experience that the person has almost drowned, so from that experience, from that moment onwards, he or she will start to develop fear of water. That is aquaphobia. Okay, so like that, like, you can say, like, driving phobia. So here, if person has been in an accident, so from then onwards he will fear or she'll fear driving. So fears are acquired, and because of some traumatic incident or some situation the person has experienced, and from then onwards the person will avoid that situation or that dreaded object, and which allows the fears to become more and more entrenched in the person. So what is there is classical conditioning. Okay. For example, there is a situation and the person has been kidnapped, for example. Okay. So classical conditioning is fear by